Hey everyone, welcome. Today, Dr. Christophe Delong and Kinexa are bringing us an incredibly deep visual dive into what is easily the most fascinating neurobiomechanical architecture in the entire human body. I want you to just completely forget whatever you thought you knew about your joints, because today we're looking at what is essentially a biological supercomputer that's been perfectly paired with elite mechanical engineering. Let's get right into it. To really wrap our heads around this biological machine, we're going to break it down system by system. We'll start with the transmission interface, then look at the kinematics of the condyles, the ligament architecture, the menisci as dynamic shock absorbers, the neurological and motor control, and finally, the patella as a strategic lever. Basically, we're working our way from the raw hardware and suspension all the way up to the software and the drivetrain. Section 1. A transmission interface that goes way beyond a simple hinge. It is definitely time to shatter the illusion that the knee is just some basic, clunky mechanical joint. So looking at this, you can see the knee joint is actually a highly sophisticated force transmission interface. Notice the asymmetrical geometry here? We've got the femoral condyles up top and the tibial plateaus down below. This definitely isn't just a flat pivot. The shape you're seeing choreographs this incredibly delicate, constant balance between rolling and sliding. It is managing extreme stability while simultaneously allowing for extreme mobility.
And here's the first major parameter of this machine. 140 degrees. That is the absolute maximum flexion this structure can hit, which is dictated by the compression of your tissues. Think about that for a second. That is a massive range of motion for a joint that's literally supporting your body weight 24/7.
But here is where the engineering gets absolutely mind-blowing. 8 times. When you jump, the impact force transmitting through this joint can spike up to 8 times your body weight. No joke. To handle that kind of load without just completely dislocating, your body needs millimeter-perfect neuromuscular coordination.
Which brings us to Section 2, the kinematics of the condyles, or the mechanics of motion. How on earth do these bones support those massive loads while still moving so freely?
Well, when we compare the two condyles directly, we find an evolving center of rotation, and it's all thanks to this vital asymmetry. On one side, the medial condyle is longer, narrower, and much more curved. This guy acts like an autopilot, driving the terminal locking rotation when your leg is fully straight. But on the flip side, the lateral condyle is shorter and less curved. This allows for increased mobility and the sliding you absolutely need for rotations. They are totally different shapes, but they work together in absolute harmony.
And here's how they actually move together in real time. For the first 20 degrees of flexion, it's pure rolling. But once you push past 90 degrees, progressive sliding completely takes over. This ingenious femoral rollback mechanism basically stops your bones from crashing into each other, and as a bonus, it actually increases the leverage power of your quadriceps. How cool is that?
Moving right along to Section 3, ligament architecture, the structural sensors. It is time to ditch the idea that ligaments are just dumb, inanimate ropes holding you together.
Let's zero in on the anterior cruciate ligament, or the ACL. Nestled right in the heart of the intercondylar notch, it's a tiny bifascicular structure that's only about 3 centimeters long, but it is so much more than just a mechanical break. It's actually a highly sophisticated sensory organ. This is exactly why tearing your ACL isn't just a mechanical breakdown. It causes a massive neurological disconnect in your body.
The specs on this thing are just staggering. It has 2 distinct bundles to manage both flexion and extension, and it's literally packed with mechanoreceptors feeding real-time data straight back to your brain. If there's a threat, the ligamentomuscular reflex fires a response in under 50 milliseconds. Plus, it single-handedly provides 85% of the holding force against the forward sliding of your tibia. And the real magic here is the synergy. Your hamstrings act as natural allies to take the load off the ACL, while your powerful quad contractions pull it taut.
All right, Section 4, menisci, the dynamic shock absorbers. Think of these as your body's biological suspension system. They're what turn those massive impacts we talked about into manageable forces.
Just like the condyles, our 2 menisci are completely different from one another. The medial meniscus has this C shape. It's larger, but it's really locked in place. That lack of mobility makes it vulnerable, right? It just can't flee from a brutal sudden impact. The lateral meniscus, though, it's shaped almost like a closed O, it's thicker, and it is highly mobile. When you bend your knee, it can slide back up to 12 millimeters just to track the movement and stay out of harm's way. Their job is absolutely critical. They absorb between 50 and 70% of all shocks, And they do this by taking destructive vertical compression forces and literally transforming them into horizontal tension. This mechanism saves your cartilage. Without these little shock absorbers, you'd be looking at bone-on-bone contact that would just obliterate your joint under pressure.
Section 5. Neurological and Motor Control. The knee's software processing units. It might not be the smartest joint in your body, but it is undoubtedly the most vigilant.
The knee joint is densely packed with sensors that create this constant, non-stop feedback loop with your central nervous system. This ultra-fast communication results in a cortical muscular latency of just 40 to 60 milliseconds. That means your body is making lightning-fast micro-adjustments the second you even slightly lose your balance.
And your brain delegates all this work at breakneck speeds. The primary motor cortex handles voluntary control and fine-tuning. Meanwhile, the cerebellum is playing the role of a biomechanical predictor. It's comparing internal models and correcting errors in just 10 to 20 milliseconds. At the same time, your basal ganglia are storing automated stabilization routines. For an expert or an athlete, this stabilization becomes totally instinctive, which frees up their brain power to focus on other things.
But here's the catch. Muscle activation needs absolute synergy. To properly secure the joint under a heavy load, you need a very specific ratio of 1.5 for the quadriceps to 1 for the hamstrings. This incredibly precise co-contraction is exactly what guarantees stability and protects the entire system from failing. And remember, your quadriceps isn't just one big block of muscle. It's a 4-cylinder engine. The vastus medialis is crucial for that terminal locking we talked about. It hits 80 to 85% activation during a lunge. The vastus lateralis brings the power and lateral stability. The vastus intermedius generates pure extension force. And the rectus femoris is a biarticular muscle linking the whole setup to your hip. Oh, and we can't forget the popliteus muscle in the back, which is literally the key that unlocks your knee from full extension. Finally, Section 6, the patella, or kneecap, the strategic lever and biological drivetrain. This is the centerpiece that makes upright human mobility a reality.
So the patella just floats right there in the extensor apparatus, acting as this incredible strategic lever. Simply by pushing the tendon away from the center of rotation, it boosts the mechanical efficiency of your quads by 30 to 50%. Seriously, without this tiny floating bone, standing up from a deep lunge would be physically impossible.
But all that extra power comes with a cost, and that cost is friction. And that is exactly why, right on the back of the patella, we find cartilage that's up to 7 millimeters thick. That is literally the thickest cartilage you will find anywhere in the entire human body.
And why does it need to be so incredibly thick? Because perfect neurological tracking is an absolute must. Just walking up a normal flight of stairs can push the pressure on this tiny little surface up to 7 times your body weight. And that wraps up our deep dive for today. We've looked at the hardware, the suspension, the software, and the drivetrain. So, now that you've seen the data and you understand the blazing fast, invisible engineering happening inside you every single millisecond, how are you going to think differently about your next simple step? Take a second to really think about that. Thanks for joining us on this fascinating explainer, and keep staying curious.